Should I start?
Yeah, let's go.
Hello, everyone. Today we are going to talk about something very important, dental health. This is something that's important to all of us. I'm Lynn Alexander, and I'm really excited to be your host for this live show. We've got a fantastic show planned for you. We'll be chatting with Dr. Kumar Vadivel, who we all know as Dr. V. He's an amazing dentist with lots of knowledge about teeth. He's going to share with us the latest in dentistry, how to keep our teeth healthy, and how to get dental care without spending too much. Whether you already know a lot about dental care or just want to learn how to keep your smile looking great, you're going to find this really interesting. We are going to explore lots of topics like why it's so important to brush your teeth and what new things are happening in dental technology. We've already received some great questions from you, our viewers, and we're excited to answer them. Remember, you can send more questions during the show. Before we begin, I want to tell you more about Dr. V. He's not just any dentist, he's a periodontist. That means he's a specialist in taking care of gums and preventing gum disease. He works at ToothHQ Dental Specialists, which you can find in the Dallas-Fort Worth Metroplex in Texas. And there's something really cool. He's writing a book that's going to be released this year. To learn more about Dr. V, you don't forget to visit our website at www.mytoothhq.com. So get comfy and get ready to learn a lot of cool things about taking care of your teeth. Let's start your dental live show. Welcome everybody, and now let's give a warm welcome to Dr. V and get our show started.
Thank you, Lynn. Thank you very much. Hi, everyone. I'm Dr. Kumar Vadivel, Dr. V. I'm very excited to be here today. I'm a board certified periodontist, and as Lynn said, I specialize in treating gum and bone disease, placing dental implants, and performing oral surgery. I'm also a member of the American Academy of Periodontology and the American Board of Periodontology. I founded ToothHQ Dental Specialists with 4 locations in the Dallas-Fort Worth Metroplex. We focus on treating gums and teeth with focus on healthy teeth and gums. I'm here to answer any questions about your dental health. Ask them live or for our next show, and your input really helps us improve our show. If you enjoy our content and our show, please give us feedback, like us, subscribe to our channel for updates and dental health tips. We look forward to your questions and helping you achieve the best smile. Let's get started.
All right, Dr. Vadivel, thank you so much. So, one of our followers has sent in a few questions. We have a few questions from our followers. So, here's the first one. Is it possible for children to experience gum disease?
So the question is it possible for children to experience gum disease? Absolutely. The answer is yes. And not only the children are going to experience gum disease because the same bacteria that lives in the adult mouth, it is possibly like, maybe either in the same amount or maybe in a lesser amount. It's going to live in children's mouth also. So definitely for them to experience gum disease either because of the bacteria or because of the bad oral health, which means they are not taking care of their teeth with brushing or flossing properly, they will definitely get gum disease as well. And also, one most important thing that we always teach and preach in our Tooth HQ dental offices, and also we teach all our referring doctors. And when adults have gum disease, when they are sharing their utensils or they are sharing their food with their children, there is a very good possibility that they are possibly just transmitting their gum disease to their children. So make sure that when you have gum disease, if you're an adult watching the show, then make sure that you get your mouth checked so you're not passing the gum disease to your children.
Thank you very much. The next question is, does IV sedation not actually put someone into a sleep state like propofol does?
So the question is, the IV sedation and the propofol sedation, or what we call it as a deep sedation, is the same. So what we normally recommend, or what we normally say in our office, and we do a lot of IV sedation on a very regular basis, and we do some deep sedation on an occasional basis also. So the IV sedation is more like what we call it as a twilight, or a very more like a conscious sedation. So what that means is, if we are going to ask the patient to respond, they are going to be able to very well respond. Like, let's say if I'm going to tap on somebody's shoulder, hey Lynn, wake up, hey Lynn, take a deep breath, hey Lynn, open your mouth, then she will be able to respond when she is getting a conscious sedation. Whereas if she is totally deep sedated, then she won't be able to respond to our commands as well as she does when she is going to have conscious sedation. So that's kind of the difference between what we call it as an IV sedation as opposed to a deep sedation. And these two sedation are completely different than the one that you get in the hospital when you are going to be put to completely asleep like a rock, and when you are going to have your abdomen open to have a surgical procedure done, that we call it as a general anesthesia. So those are the the differences between the three levels of sedation, which is the lightest one being the IV sedation, the next one is the deep sedation, the next one after being the general anesthesia.
Thank you very much. Let's see. Is coronectomy a suggested choice when extracting wisdom teeth?
So the question is coronectomy a suggested choice when extracting wisdom teeth? So first, most of you guys may not know this particular follower. They really have a specific question about coronectomy. So first, I want to show you guys, what a coronectomy means. So, for example, this wisdom tooth needs to be removed here, and because this wisdom tooth is very close to the nerve, and you guys may see right here, this is the nerve. The tooth is kind of almost passing through the nerve, and the chances of having some kind of a, what we call it as a numbness on the chin or the lip is high if we are going to end up, or if we are going to end up getting close to the nerve, or if the nerve is getting pinched at the time of the procedure. So what we normally recommend we do is not to put any pressure or any type of trauma to the nerve. So we recommend we just cut the crown off, as you see here on this third picture right there. So we cut just the crown off. So that's what the word coronectomy means, cutting the crown off. So coronectomy. So what that coronectomy means is, if the tooth is very close to the nerve, yes, we do a coronectomy procedure, and whether it is a recommended procedure or not, that depends on the case. Whether the coronectomy is done on all cases, probably not, but is it done on some cases? Yet it can be done if you are a risky candidate to have the whole tooth removed.
Thank you. That's very interesting. I don't think I've ever seen it explained that way in the 30 years I've been in dentistry.
Awesome, awesome.
Okay, so the next question, should a previously root canal treated tooth be removed and substituted with individual teeth, implant, or a bridge? And then it's kind of a two-part question. And the second part is it advisable to use braces or aligners for teeth alignment in this case? So for part one, um, is it recommended for a root canal treated tooth to be removed and substituted?
So the first part of the question is, should a previously root canal tooth be removed and replaced with a bridge or an implant? The gold standard of care nowadays is anytime a tooth is removed, whether it is a root canal treated tooth or a broken tooth or like a deep, like a really big cavity tooth, anytime a tooth is removed, except for the wisdom teeth, we always recommend that tooth to be replaced with a dental implant, which is the gold standard of care. Of course, can that tooth be replaced with the bridge? We do not recommend doing replacing a tooth with a dental bridge, because anytime you need to do a bridge, what that means is if you have a missing tooth on this side, missing tooth, sorry, you have a tooth on this side and you have a tooth on this side, and then you have a missing spot, then you have to grind the two teeth on either side to be able to connect them like a bridge. So we do not normally recommend that. We even call that as a, this is kind of a barbaric treatment which we used to do several years ago, which is even still done some of the times. But the gold standard of treatment is without touching the two teeth on either side, put a dental implant right in the middle, just like you guys see right here in this model. So when you have two teeth, so you have an implant here or an implant here, and then you can have a, actually this is not the best demonstration. Actually, this is the best demonstration right here. I don't know whether you guys can see it clearly. So a bridge, you have to cut the tooth on the front, cut the tooth in the front, and to put a 3-unit bridge. Whereas for an implant, all you have to do is to put an implant just like this in the front. So you don't have to touch the tooth on this side, touch the tooth on the other side, and you can put an implant right in the middle where you have a missing tooth spot, and you can replace the tooth with an implant. So that is the part one of the question. So my recommendation would be to highly consider doing an implant. And the second part of the question is it advisable to use braces or aligners for teeth alignment in this case? I'm assuming the follower is concerned about some kind of a tooth movement because of either the missing tooth or possibly the root canal tooth is being damaged. So the ideal way to do this is after you remove the tooth, do the aligners or do braces to adjust the teeth or move the teeth properly to the proper alignment of the teeth. Then after the teeth come into the proper spot, put an implant to replace the missing tooth.
Great. So I'm going to just kind of recap and summarize. So, yes, replacing with a single implant is better than doing a bridge,
Mm-hmm.
is what I'm hearing you say. And then, secondly, before you do any kind of braces, ortho, whether it's the clear braces or whether it's the traditional, you recommend doing that prior to placing the implant so that the room is created that you need for that implant and that crown to be. Correct? Is that what we're
Absolutely
saying?
correct. And then just to add one more thing, and I'm glad you mentioned that, the reason it is critical is we always say that implants, they look, function, and feel like a natural tooth. But unlike a natural tooth, the implant cannot move. So once you put that implant in there, that is going to be there solid, just like a rock. It's just going to be rock solid there. So you cannot move an implant. So the braces can only move the tooth. They cannot move the implant. That's why it is critical that you get the braces prior to putting in the dental implants.
Awesome. Thank you so much. Okay, so for our next one, our next listener that is wanting us to ask a question, it says, I'm a 53-year-old and I had my last lower wisdom tooth removed 3 weeks ago. I've been experiencing intense discomfort from the wisdom tooth extraction for the past 3 weeks, and it's not improving. I've lost feeling in my lower teeth, and the pain in my chin is excruciating. Nothing seems to relieve the pain, and it's making me feel depressed and frustrated. Additionally, I've developed a sore on the inside of my lower lip due to injury. What steps should I take to manage the pain and soothe the affected nerve? Will surgery be necessary?
Um, so I I apologize for possibly the problems that you are experiencing, and I don't know where you had the procedure done. I don't know the real circumstances, how risky your procedure was, and whether you have any type of medical complications or medical conditions that may have caused some of the problems that you are experiencing. So from what I'm hearing, you're experiencing pain, you're experiencing numbness following the procedure, and the pain is not getting better after a few weeks of the procedure, and you feel depressed about the procedure and what are all is going on. So at this point, um, my recommendation is, whoever did the procedure, talk to the dentist and then see what kind of an evaluation they can do to see the reason why you are in pain still after 3 weeks. Either they may be able to give you some antibiotics, or they may be able to give you some additional pain medications, or they may be giving you some soothing gel, or a combination of all of the above to get you out of pain. As far as the numbness, if it is a temporary numbness, and a lot of times the numbness is going to come back after a few weeks after the procedure. If the numbness is continuing several weeks, like say 6 to 8 weeks after the procedure, that's when I will be concerned. Then again, you will need to talk to your dentist or your surgeon to see what all can be done. And sometime when you experience some type of numbness, we always give you some additional medications as well. So talk to your dentist or the surgeon to see whether you need any kind of medications or any other type of treatment to improve the numbness. And as far as the feeling depressed, and I'm hoping that things are going to resolve, and then you're going to be able to get out of this anxiety and the depressed state. And my recommendation would be to follow up with the dentist or follow up with the surgeon, whoever did the procedure, and I am sure they should be able to help you. And if you happen to be in the Dallas Fort Worth area, come see us, and we can definitely take a look and give you a second opinion to see what we can do to help you.
All right, thank you so much. The next question is there a way to receive dental implants without incurring any costs?
Uh, so the question is there a way to receive dental implants without incurring any cost? Um, The answer is absolutely yes, you can, but there is not a lot of places which are going to offer this type of treatment for free. And I happen to notice, like I believe, like in either on the newspaper or like in one of the community channels, they were doing some kind of a study on a new dental implant coming in. So they were offering the dental implant for a lower cost. Of course, they are not going to be totally able to do it for free. They were offering it for a lower cost because they were trying some type of a new treatment. So to answer your question, you definitely can look for places to see whether the dental implant can be offered at a lower cost as compared to your local dentist. And one of the greatest other ways to get any type of subsidized cost treatment is your local dental school. So if you happen to be in an area where you have a
Mm-hmm.
local dental school, so go to the dental school. And here we are in Dallas, and we have a dental school. And if you happen to be in Texas, we got about 3 or 4 dental schools in Texas, and you can go to any one of those dental schools to get the dental implant treatment at the subsidized cost, or look for clinics they are offering at a subsidized cost, or look for some of the implant centers, and if they are trying out any type of treatment, they will be able to do the dental implant treatment at a subsidized cost. And a lot of times when patients say that they are not able to afford for the dental implant, it is just not the it just either we usually ask them. I think, Lynn, you're probably super good in doing that. And tell me the question that you ask. Is that the whole amount? What do you say?
Yeah, I usually ask them if it's the entire amount of the treatment, the total cost, or if it's fitting it more into a monthly budget that will allow them to do something that they may not be able to do if they have to pay up front.
So to tell the listener here, so
Mhm.
what would you tell them? So to come in for a consult if they happen to be here?
Absolutely,
Yeah.
absolutely. I would tell them to go ahead and come into for a consultation and let us evaluate, see what kind of a treatment plan we would come up with, and then we would go over every bit of the financials with them, offering them everything that we can do to help them either fit it into that budget that they need monthly or help them find a way to afford it, to do it by, maybe a prepayment discount or something like that if they were able to do it that way. But we have multiple ways of helping people fit things into their budgets.
So this is what we say in our office, and you can get a dental implant done as low as about $99 a month. And some patients, when they come in, they don't have the money, and we try to go through and with the work with the banks to see whether we can get them on a payment plan. Sometimes they do not even qualify for those payment plan options. So either we try to do an in-house payment plan, or we call it as a layaway payment plan. Think about this. Some families, they cannot afford to pay even gifts for Christmas, so you kind of lay away the money with Walmart or Amazon to buy the gift at the towards the holiday season. The same way. So let's say, for example, you need to have a tooth removed and a bone graft done, and then followed by the implant. Sometimes this treatment may take like about 6 months or 9 months or even up to 12 months. So you got all this time to lay the money away with this, and at the end of that period, we'll be able to absolutely complete the treatment, and just like we do. And I am sure you will be able to find a dentist locally in your area. They should be able to help you. So the bottom line, talk to a local dentist, and they should really be able to help you with multiple ways. They can help you with any type of treatment they can offer.
Absolutely. Thank you so much. Okay.
I'm actually going to go get a. Oh, sorry, I forgot to put the charger. Keep talking. Yeah.
Okay. So while Dr. Vadivel is gone, we have multiple questions here from people, so I will have him answer those when he comes back. But while he's gone, one of the things that he already kind of touched on is something that we talk about here in our office. So I'm going to just review it with you quickly. So in our office, one of our questions earlier was, is it possible for children to experience gum disease? And so he was saying yes, it can be transmitted from a parent to a child, a grandparent to a child. So every one of our consultations that we have, we go over this body-mouth connection. So when you have gum disease, it's not something that just stays in your mouth. It actually affects your entire body. It gets that bacteria gets and the infection gets into your carotid artery. It goes to your heart, your lungs, your brain, your pancreas, your liver. It also affects gender specific issues. Men, it can cause erectile dysfunction. Women, it can cause birth problems, low birth weights, and just different pregnancy issues. And it is something that will affect your life. It's like the silent uh, disease. You don't know that it's a problem until it's a problem. And then it's also, we call this the kissing link, and that's how it's transmitted from one person to another. So if you have gum disease, you can pass it to your spouse, your boyfriend, your girlfriend, by kissing them, by sharing utensils, by coughing and even sneezing around them. So it's very important to watch that and get it corrected as soon as you can. Have your family members checked and know that in some instances sharing is not caring. So just
Absolutely.
keep your eye out for this for yourselves.
Well, I'm so glad, like, I gave you that break and you were able to give them all this education while you were talking. And I thought, like, something very, very critical and very important. All of our followers and listeners should know, and they may not be aware. And I don't know how many of you guys have read this in the news. The former NFL player Mike Williams died of dental related infection. That happened, as you guys see, the date. Look at the date. This happened in December 2023, just a few weeks ago. So not only we talk to our patients about the mouth-body connection and the kissing link, we always tell them either whether they have active gum disease or whether they have any type of dental infection. We don't want this to become really serious, get into your body, and even go to the level of even causing death. And I'm not trying to scare you away, but at the same time, it is so critical. Sometimes you may not even know what is going on. So it is so critical, and it is easy. Hey, all you got to do is like go to the dentist. In our office, we call it, just go Nike. Just do it,
Just
right?
do it.
Yeah,
Yes.
just do it. Go to the dentist, and they should be able to help you.
All right. Thank you for following up on that. All right. So our next question is from a 51-year-old, and it says, "My wisdom tooth has completely erupted. Nevertheless, my dentist is strongly advising its removal. I did have my left lower wisdom tooth extracted back in 1993, which did result in numbness in my lower lip when I was 21 years old. What's your opinion on this, and what would you suggest, doctor?"
Um, well, we always say that. Sorry, let me repeat the question here. So our follower, our listener is 51 years old, and she has a wisdom tooth that is causing a problem, and the dentist is recommending a removal of this tooth. However, because of the past experience of having one of the other wisdom tooth removed and having some kind of a numbness, she's a little skeptical about having this wisdom tooth removed. So, um, we are all about prevention in our office, and we normally recommend that you get your wisdom teeth removed when you are at a very young age. So I don't know what age you got the wisdom tooth removed and that caused the numbness. And I've been doing this for the last about 30 years. And of course, I'm not going to say that I never had any patient with no numbness, but of course we do. But most of our patients, do very well, and the chances of numbness happening in our office is very unlikely. So if when you're young, get them removed so you don't have to have any type of risk of any causing any numbness to your mouth. However, to your question, and I don't know about your circumstances why you had some kind of a numbness, but that doesn't mean that you should shy away from having the other wisdom tooth removed. And one of the most common reasons on older patients when they need to have the wisdom tooth removed, they are going to need that removed because the tooth in front of that is getting decayed, or the tooth in front of that is getting a lot of gum disease. So you don't want to come to a stage that you're going to leave that wisdom tooth that is being recommended by your dentist. You don't want to leave that for too long. Then now it is going to cause damage to the tooth in front of that. So again, talk to your dentist, and if you happen to be in the Dallas Fort Worth area, come see us or wherever you are. And if you want to get a second opinion from a periodontal surgeon, they should be, or an oral surgeon, they should be the one to give you the best recommendation about your risk.
Thank you. All right. Could you provide insights into the intended uses and prerequisites for the, I'm not sure how to say this, Dr.
Aiden,
Vadivel,
Aiden
Aiden
Turek,
Turek,
yeah.
zygomatic dental implants, including the specific patient groups and surgical methods involved.
So what this caller is asking is they have a question about a specific type of implant or a specific brand of implant, I should say, aid in Turek implant. That is what they're having questions about. For example, and I don't know where this caller is from. In the United States, some of the most popular brand of implants are um, Straumann, Nobel Biocare, Dentsply, or Astra, or Zimmer. These are the most popular implants in the United States, and Aiden is one of the brand of the implants. But forget about the brand. But the caller has questions about what we call it as a zygomatic implants. So what zygomatic implants mean, like the implants that you see in the front, Those are the regular implants right here. And the one that goes into the cheekbone right here. So we call it as a zygoma. So the one that goes into the cheekbone, it's called the zygomatic implant right here. You see that? And the other one is right here. That's another zygomatic implant. So what those zygomatic implants are, from what I'm hearing, that someone recommended zygomatic implants for you. So again, I don't know how much of bone deterioration that you have, or what we call it as an atrophy. So when you have a lot of bone eroded away, and if you, I don't know about your age, so if you have waited for a long time after the teeth were removed, or if you have been wearing denture for a long period of time, you almost have no bone. I'm saying like almost no bone. So you don't have bone to place any implants in the front. So in those cases, we recommend we place the implants into the jawbone or the cheekbone here, and those are called the zygomatic implants. Again, depending on whichever part of the world you are in, and they may have recommended this Aiden implant. So definitely, and if that makes sense to what I'm saying here, depending on your age and the condition of the bone and the time that you've been wearing your dentures, if they recommended the zygomatic implant, and I can definitely imagine you are a candidate for the zygomatic implants.
All right. So at this point, I am going to ask you some questions, Dr. Vadivel, that we're going to just go through them. There's a few questions here. I'm just going to go through them fairly quickly,
Like this?
just like this.
Okay.
Rapid
Perfect.
fire. We're
Rapid
going to do
fire.
some rapid fire.
Awesome.
All right.
Awesome.
Is gum disease contagious?
Absolutely yes.
Can vaping cause oral cancer?
Absolutely can.
Is laser dental therapy safe during pregnancy?
Absolutely yes, depending on the way, which term you are, which trimester you are in. Absolutely yes.
Okay. I'm allergic to metals. Can I get non-metal dental implants?
Absolutely you can. We call that as a zirconium implants or a ceramic implants.
Can my denture be converted to an implant denture?
Absolutely they can be. You know, we call it as a locator dentures, and your regular denture can be converted to an implant denture.
Awesome. That was pretty quick there,
Yeah,
Dr.
there we
V.
go. You said rapid fire, right?
I did. All right. So we have some questions that have just come in from a few of our loyal followers. And so we're going to answer those before we continue with our live show. Okay. So our first question that has come in is, hello, doctor. I live in Spicewood Lane in Carrollton. I'm a 40-year-old and suffering from periodontitis for the last few years. Is laser therapy good for me? Also, can laser therapy lead to scarring or gum pigmentation?
So what the follower is asking is, when they have gum disease, is laser therapy or laser gum treatment good for them? So absolutely, depending again, I wish I could look into your mouth, and but without looking, I can definitely say, if you think that you have gum disease, and there are two types of treatment that we offer. Either the first one, if you have advanced gum disease, and we do laser gum surgery, or if you have either early to moderate gum disease, and sometime you may just need the regular, what we call it as a scaling and replaning, or a deep gum therapy. And what we do in our office is we want to promote the healing, and we want to minimize the bacterial destruction as much as possible. So we do what we call it as a laser adjunctive deep gum therapy. So we do that. And so definitely a laser is one of the best options you can think of, either to treat it in with the adjunctive way, with the deep gum therapy, or with the laser gum surgery. And the second part of your question is that going to increase the scarring? No, it is not going to increase any scarring, or it is a non-invasive procedure. What that means is you may not even know that treatment was done using the laser. So it is not going to cause any type of scarring at all.
Wonderful. Okay, our next question is, what is the cost difference between laser gum treatment and traditional treatment? Are there any ongoing promotions?
So what is the difference between the regular gum treatment and the laser gum treatment is the question from this follower. Absolutely. There is a different. There is a treatment difference as well as a cost difference because we are going to use this laser. And as I said earlier in the previous question, so when we do the deep gum therapy, we do the laser as a just as an adjunct. So there is a very small cost to that. Whereas we are going to have a complete full mouth. We call it as a four quadrant, right? Four quadrant laser gum surgery, which usually takes like about 3 to 4 hours or maybe even a little bit longer.
Hmm.
So that requires like a lot of precise work, and there is a lot of work that needs that is involved. So that may end up costing a little bit more. So second part of your question is whether do we have any promotion? Absolutely. We are all about helping our patients here. So we do have promotion that we run. We run on a very regular basis. So check our website or check our. A lot of you guys are following us on Facebook or other social media like Instagram and TikTok and all of that. So and YouTube. So check our social media channels for the promotions we run, and we are happy to help you anytime.
Yes, we are. All right, so the last question is, says, "Hi doctor, my son is 14 years old and his front tooth is broken. My dentist suggested extracting it and getting an implant. I'm a little worried it's too early to get an implant since he's still growing. What is the right age for getting an implant?"
A great question. So this is one
Absolutely.
of the most common questions that asked by the parents, and particularly with a lot of sports injury happens, on some of the kids when they're playing sports and they lost the tooth at an early age, or some kids when they are going through braces and the teeth never came in. So it's one of the common questions people ask. So the right age for the kids to have the dental implants is after they finish growing. So for some kids, the depending on the kid, when do they finish growing, it may differ. Generally, we say the uh, the right age for the girls is about 14 or 15 when they stop growing, and for the boys like maybe around like 16 or 17 when they completely stop growing. So when the parents bring them here for treatment of either a missing tooth or the tooth that got broken, so we ask them, one of the most common questions that I ask them, hey, are you still changing your shoe size? Are you still changing your clothes sizes? So when they do, that means they are growing, particularly the shoe size. So then we tell them, hey, wait until you finish completely growing, then we can do the implant. Again, same thing with the boys too. So we always tell them once you stop completely growing, then we will do the implant placement. So one of the common question that asked is, hey, what do I do in the meantime? So to prevent the tooth movement, because anytime you have a missing tooth, the teeth will start shifting. That's one of the main reasons
Hmm.
why we do dental implants, right? So what we normally tell them during that time is what we call it as a retainer. So we call it as a retainer or like a braces. So it is like a clear retainer like this. So you wear them on the tooth, like see here, for example, in this one, this patient had a missing tooth in the front. So this patient is going to wear this as a retainer to retain, just like the word it sounds, it's going to retain the space. So once you finish growing, then we are going to replace the tooth with a dental implant.
Absolutely. All right, so this next question, um, I'm interested in getting dental implants. What's the best way to begin the process, and what should I anticipate in terms of cost and expense? Can I answer that one?
Sure,
All right.
totally, man. Be my
So,
guest.
um, the best way to get started is wherever you live, whether you're here in the Dallas Fort Worth area or somewhere else. Of course, if you're in the Dallas Fort Worth area, come to ToothHQ Dental Specialists to one of our 4 locations for a free consultation. And we will guide you in from taking the CT scan to finding out exactly what your needs are, what your goals are. We will guide you as far as the expense. We'll give you a complete cost estimate and also try to help you find a way to fit it into your budget if that's what you need to do. So our recommendation is absolutely go into your dental office, a specialist, or come to see us, and we are glad to help you get started with your dental implants.
Thank you for like making my life easier. Ask the question and answer it, right? Fantastic. You want to take the next one too?
No, I'm going to let you do this one. What are the convenient and efficient options for replacing missing teeth, and what is the associated costs?
I think you should take the next
I
question. There we
probably
go.
should.
Yeah,
So
right.
the efficient options for replacing missing teeth, Dr. Vadivel actually kind of explained it a little bit ago. It is one, always, if it's a single tooth, an implant, single tooth implant, even multiple teeth you can replace with implants, or bridges. Those are the most simple ways to replace teeth. Um, there are other options for removable options, but most people don't like that. So we are in the business of trying to help people get what they want when they want to fix their mouths. So as far as cost, again, without seeing you, it's hard to say exactly what the cost is going to be, but we can always give you that estimate when you come in and go over it with you and try to fit it into a budget for you. So don't let cost be the deterrent to keep you away from the office. Come in and at least see what your options are.
One of the most common things when patients ask me about like, hey, what type of treatment do I need? Whether what type of teeth replacement options? Hey, here we go. I got a smartphone. Do I really need a smartphone to make phone calls? I don't need
No.
a phone. I can just do it with a flip phone, right? So if you are a smartphone user, right? Let me take your smartphone away and give you the flip phone. How would that make you feel, right? So yes, can you make a phone call with this with a flip phone? Of course you can, but we don't do that. So the same way, can you replace a tooth with a flipper? Yeah, of
Mm-hmm.
course you can do that. Can you replace the teeth with the bridge? Of course you can do that. But those are not the modern age treatment. So we
Absolutely.
live in a smartphone world. So you want your teeth to be smart also. So you want to replace them in a smarter way. So if you happen to have a bridge, like I said earlier, so if you have two teeth on either side, you have to grind the two teeth on either side. That's not a smarter way of replacing them. The smarter way to replace them is leave
Just
the two teeth
mhm.
alone and put the middle tooth with an implant and replace it with the dental implant. So get smarter. We say go Nike, just do it. Dental implant is the way to go.
Yes, it is. Okay. So the next question is, most of my teeth are damaged with a few broken fragments embedded in my gums, and I'm currently at my mom's house experiencing significant pain. Can you please offer some guidance, doctor?
Well, so it looks like you have a lot of broken teeth and you are experiencing a lot of pain from those broken teeth and you are in your mom's place and you want me to offer some guidance, and I wish I could look into your mouth and tell you like, hey, what needs to be done, but from what you are describing to me, that you have a lot of teeth that are broken at the gum line, that means you have been neglecting your teeth for a long time, or you're shying away from going to the dentist for a long time. So my simple answer is just like Lynn said earlier, go see a dentist, go see a periodontist, or go see your oral surgeon in the area. They should be able to help you with whatever that needs to be done. My biggest concern is if you have been shying away from going to the dentist, and I don't want you to get any type of infection. I don't know whether you've been listening to the show right from the beginning. We talked about an NFL player dying from a dental infection. So again, I don't want to scare you, but at the same time, I definitely want to give you the word of caution. You don't want the infection to get into your body and make you feel sick and miserable. So to answer your question, so you can take possibly some over-the-counter pain medication. You can take some Advil or Tylenol, or you can double up on the Advil or Tylenol, or you can take both. but that is again going to be a bandage, and that's going to be temporary. So if you are in your mom's place visiting them, have a good time and just stay with them, and then take the temporary measures. And as soon as you have a chance to go home or visit a dentist, and visit the dentist and get you taken care. And we don't want you to be spreading the infection to your rest of the body.
Absolutely. The next question is says, "Hello, doctor. I am inquiring about your video on safe wisdom tooth surgery near the sinus cavity. Could you please provide information on the anticipated recovery time for this surgical procedure?"
So the question is, the the safe wisdom tooth surgery when a wisdom tooth is lying close to the sinus cavity. So first of all, thank you for watching our video on our social
Mm-hmm.
media channels, and we appreciate it very much. And so what you're asking me is your one of your wisdom tooth is possibly like lying close to the sinus cavity. This is your sinus cavity on the right side and the left side here, and one of your wisdom tooth is possibly lying close to the sinus cavity. So whenever you go to your dentist, and they should be able to, in this modern age, we all do what we call it as a CT scan or a CAT scan. In our
Mm-hmm.
office, every single one of our patients get the CT scan or the CAT scan when they come for their initial exam or the initial consultation. So once we do that, we should be able to evaluate how proximal is the tooth to the sinus cavity, and depending on that, your dentist or your surgeon should be able to explain to you how safe it is for you to do the procedure. I can tell you, doing this for the last about 30 years, it's relatively safe, or it
Mm-hmm.
is very safe, depending on however close it is to the sinus cavity. Only on very rare occasions, we shy away from not removing a tooth if it is really high up, near the sinus cavity. On most occasions, we are able to remove them very safely. And to second part of your question, what is your recovery like? Again, depending on whether what is your age, and whether you have any type of medical conditions, whether you do have any type of infection on the tooth that needs to be removed, all of those are going to determine the recovery time from the procedure. I tell the story all the time to the college kids who come see me, and we are in Dallas, Texas. We got multiple colleges here and multiple colleges
Mm-hmm.
even in Austin and College Station. So I tell them all the time, kids come to see me on a Friday evening, get the wisdom teeth removed. I don't even see them for a follow up, and they are driving on Sunday to college back. So it could be as simple as like a day or two for your recovery, all being well. So I hope I answer your question.
Adding to that, habits also play a part in how they heal, correct?
Absolutely, yeah. Smoking, for example, it may make your recovery miserable. So do not smoke, and we give you a bunch of instructions following the procedure. Do not suck with the straw, and do not eat anything hard. And we do give and use the ice pack. If you follow the instructions carefully,
Mm-hmm.
and for the most part, the recovery is going to be very smooth.
Awesome. Thank you so much. Okay, so our next question is, at the age of 66, I'm worried about undergoing sedation for a tooth extraction due to my dental anxiety. Additionally, I have concerns about numbing agents because I had a severe reaction to an epidural during a C-section 40 years ago and was advised to avoid medications from the same cane drug family. As a result, I've been avoiding dental visits. However, I recently had some dental work done, and my dentist is quite cautious and tries to keep me relaxed. We've discussed whether it might have been something else in the medication that caused my reaction, but my fear remains quite high. Is it possible to have a tooth extracted while being administered only Ativan and not recalling the procedure?
Well, there are multiple parts in this question here, so I'm going to try and see whether I can simplify the question here. So, This follower is concerned about being sedated for the procedure because she has some fears about the undergoing sedation for the tooth extraction procedure. And the second, she also has some allergic reaction from one of the drugs being used for numbing the tooth. So we call it Novocaine or lidocaine or articaine. That's what she
Mm-hmm.
called it as a cane family. Novocaine, we don't use it anymore, but I just mentioned it because that's you guys probably know as Novocaine. So she is concerned about using the Novocaine because of the allergic reaction. So and she also asked about the third part of the question, whether she can take an Ativan, which is like an anti-anxiety pill, or an anxiety pill, just like going to your doctor and then taking a Valium just before you go to sleep, right, to kind of calm you down. So what she's asking, whether she can take the Ativan, whether it is going to help her calm down. So going to the third part of the question, so can you take an Ativan to calm you down? Absolutely, you can. Is that going to help you relax? It is going to help you relax. And is that going to calm you down? Yes, it is going to calm you down. Is that going to help you not remember the procedure? Most likely, yes. You are going to have some kind of an amnesia following taking the Ativan. All of these could happen. And to answer the second part of the question, which is if you are allergic to the cane family, what other options do we have? So if we are taking Ativan and possibly can we numb the tooth, like a lot of times when patients have a true allergic reaction to the cane family, we can do the procedure sometime with just with Benadryl. Depending on the procedure, we inject the Benadryl into your onto your tooth, and then if we are able to get enough anesthesia, we are able to do the procedure just with Benadryl.
Mm-hmm.
Or very rarely, is it truly, absolutely necessary for you to have any type of anesthesia or local anesthesia on the tooth? Can you do it without, depending on like if it is a small filling, can you tolerate that without having any anesthesia possible? It can be done. Um, or the other thing is it a true allergic reaction? If you had this
Mm-hmm.
reaction long time ago, my recommendation is to go see an allergy specialist and then do some allergy testing to see whether you have true allergy. And if you do not, then you don't have to worry about like shying away from the dentist anymore. My
Right.
recommendation is absolutely go see an allergy specialist and then they can do some allergy testing so you don't have to worry about that. And then the third part of your question is, can you be, or do you need to be worrying about being put to sleep? Well, of course, people have fear about being put to sleep. If you're going to take Ativan, which is very similar to doing like a moderate sedation with IV sedation, it's no different. So if you don't have any fear about taking an Ativan, you should not be fearing about the moderate IV sedation as well. So nowadays, it's very safe for you to be doing IV sedation. And a lot of times, like I said earlier, and what we mean by conscious sedation is, hey, Lynn, wake up
Mm-hmm.
during the procedure, and she's going to wake up. Hey, Lynn, open your mouth, and she's going to open the mouth.
Mm-hmm.
And hey, Lynn, take a deep breath, and she's going to take a deep breath. So you're going to be totally conscious, and the goal of the sedation is to calm you down,
Mm-hmm.
bring your anxiety down, and yet you're going to be conscious and you're going to be in on the twilight sedation and you're going to be in the la la land, like we say in our office. Okay, so definitely I wish you good luck, and you can talk to your dentist about your options.
Wonderful. All right. So our next question is, you want to go there already?
Yeah. No. I was going to say, yeah, do you want
Yeah.
to do that, and then we can go back.
Okay. So we have a special story from one of our listeners, that followers, that I want to read to you guys, and Dr. Vadivel will answer the questions from this story as well. So um, the story is, I'm 46 and had a distressing dental experience in Ponca City and Blackwell, Oklahoma. A few years ago, a dentist advised me to have all 19 of my remaining teeth removed and get dentures. I didn't have insurance, so my mom, now in late stage dementia, paid for them. However, the dentures didn't fit from the start. Despite multiple visits and adjustments, the dentist eventually admitted that my bottom dentures would never fit due to insufficient bone, something she claimed to have mentioned earlier, but I don't recall that. She suggested implants, but I couldn't afford them. Since then, I've been without teeth for over 2 years, leading to a reclusive lifestyle and embarrassment in public. I've struggled to eat and almost lost hope. I regret not opting for a partial denture to save some teeth. I shared my story to caution others and express my wish for a more caring dentist like you.
Um, well, first of all, we want to thank you for. We don't want to be the what do we call it, the heroes of the show, right? So thank you for taking the time to share your story, so that way the listeners and our followers, can listen to your story and make some informed decision. uh, so what I hear you say that is you lost your teeth at a very young age, and you're kind of regretting the decision of having to lose those teeth, and you made the dentures, and because of the cost involved, and you could not afford for the implant, and you got the dentures, and now you're regretting the dentures are not fitting really well. um, and I'm sorry to hear that. However, and I wish I could treat, or I could guarantee all my patients when I take the teeth out, hey, the dentures are going to fit perfectly well. I wish all the dentists in the world can say that when they are taking the teeth out, the dentures are going to fit perfectly well. I'm sorry, like it is not going to be the real world, and if we are
Mhm.
going to make those kind of promises, and nobody is going to be doing any type of proper treatment and not going to be making promises like that. So um, one thing I can say that is, and I don't know the state of your teeth, and if you truly lost all your teeth at a very young age, and I'm thinking that you probably had like a lot of decay, a lot of severe gum disease, and I'm so glad that dentist, whoever helped you, he or she was able to help you to get rid of the infection in the mouth. And the reason that you are possibly healthy, although you are not able to wear your teeth, but I can definitely emotionally understand that how you feel that your dentures are not fitting well. And in defense of the dentist, then I'm sure they were able to help you to get rid of this infection, or whatever the pain that you are suffering at that time. If they did not do it, then you probably would be suffering with the pain and also with a lot of infection. So, uh, and again, thank you for sharing the
Mhm.
story. One thing I would recommend though is for other people who are listening to this, and if you have concerns about the cost for the dental implants, and again, as we talked about earlier, find a place who you can fit within your budget,
Right.
or possibly go to the dental school situation, or possibly go to a place where they can do some kind of a subsidized treatment. And again, wherever you are, whoever asked this question, again, explore these options of going to a dental school, or finding a dental implant center, which are offering dental implant treatment at a subsidized cost. Or if you happen to be in the Dallas Fort Worth area, come see us. And we talked about a lot of options, like fitting it into your budget, a payment plan, a layaway treatment. So a lot of options, and
Mhm.
Lynn is the best in offering these type of financial options, and we'll be
Well,
happy to
thank
help
you.
you.
Thank you. And it looks like we have one more viewer
Live
that is
question, yeah.
live question from one of our viewers that's watching us right now. Um, do you do bone augmentation?
So the answer is, sorry, the question is, do you do bone augmentation? So what the caller is asking is, do we do any type of bone reconstruction or bone grafting? So Absolutely. The answer is yes. We do bone augmentation. The bone augmentation is the term for bone grafting or bone reconstruction. Either you lost bone because of gum disease and that bone need to be augmented, we can do that. Or if you lost bone because of severe gum disease or a tooth being extracted, we can do bone augmentation or bone reconstruction or bone grafting prior to doing a dental implant. So again, talk to your dentist, and they should be able to help you. And sound like you're asking whether I do bone augmentation. I'm hoping that you are in the Dallas Fort Worth area. Come see us in one of our four of the ToothHQ locations in the Dallas Fort Worth area. We can definitely help you.
All right. Well, thank you so much. That is the time we have for our live show tonight. So I guess we'll pick this up next time.
Thank you all, and we will see you next time.
Thank you very much.
Take care. Until next time. Bye.
All right. Has he stopped us?